Hello, and welcome to the presentation, Understanding the Influenza Virus. My name is Odette Foster, and today we will be discussing the influenza virus. Hello, and welcome. In America, the Centers for Disease Control and Prevention, CDC, has estimated that 9.2 million people become infected by the influenza flu virus annually. There is no cure, but there are vaccines. However, effectiveness varies each year. During the 2017 and 2018 flu season, overall vaccine effectiveness, VE, was only 40%. As for the influenza A strain, which was the dominant strain that year, it was only 24% effective. Despite such low VE results, vaccines have been effective in preventing 7 million infections and saved 8,000 lives during the 2017 to 2018 flu season. This PowerPoint presentation, we will explore the nuances of the influenza virus, management of this illness through vaccines and medical treatment, followed by a discussion about two methods used to create the flu vaccine. Differentiating between different respiratory viruses. A common cold, the influenza, and COVID-19 are all caused by viruses that can cause symptoms ranging from mild respiratory symptoms to death. However, because they are derived from different viruses, the symptoms, treatments, and outcomes are different. To understand the influenza virus, one has to learn how to differentiate from the other respiratory viruses. The influenza virus is caused by various strains of the influenza virus. Differentiating between different respiratory viruses. A common cold, the influenza, and COVID-19 are all caused by viruses that can cause symptoms. Differentiating between a cold or a flu can be tricky. Image 2, Flu Fighter, illustrates some of the criteria that are more associated with one virus over the other. For example, a fever is rare in a cold, but high around 37.8 with the flu. Headaches are rare with the cold, but intense when it is present with the flu. And body aches and pains are more common with the flu, but mostly absent when a person has a cold. Differentiating between a cold or a flu can direct modes of transmission. Flu versus COVID-19. The influenza virus is spread between persons through droplets in the air, entering into the body through the nose or the mouth. Modes of transportation include coughing, talking, sneezing, thus releasing the virus into the air. COVID-19 is thought to spread both by droplets and airborne routes. Both infections can be passed without the person showing signs or symptoms that they are contagious. Direct modes of transmission. Indirect modes of transmission. Indirect modes of transmission of the influenza virus can live on surfaces like doorknobs, computer keyboards, telephones, and table surfaces. Thus, it is important to break the mode of transmission by keeping a safe distance away from someone who is possibly infected, and routinely clean surfaces and wash one's hands. Indirect modes of transmission. The most common strain of the influenza virus are influenza A, H1N1, or B. They are spread through droplets infection of the infected person. It is important to keep a distance of 1 to 2 meters or 3 to 6 feet apart. See image 3. The incubation periods for the influenza virus is between 1 to 4 days. The common cold between 1 to 3 days. COVID-19 between 1 to 14 days. The incubation periods for the influenza. Chart 1 shows symptoms and compares them to each respiratory virus. Symptoms of these illnesses include elevated temperature, a fever, body aches, cough, rhinitis, nausea and vomiting, or diarrhea and headaches, at varying levels of severity, clearly affecting multiple systems apart from respiratory system. Chart 1 shows symptoms and compares them. Clinical research. One clinical research was done on measuring the symptoms of influenza and how they affect the individual systems within the body. It was a diverse study involving 536 outpatient participants from the United Kingdom, United States of America, Mexico, and South America. The influenza patient recorded outcome, FlowPro, was used to measure reliability, and validity was tested by using the Patient Global Assessment of Influenza Severity, PGA. The clinical research. One clinical research was done on measuring the medical management of the flu. Medical management of the flu includes antivirals, which has an effectiveness to decrease the duration of this disease. Antiviral assists in the body with fighting the virus, but can only reduce the symptoms by 1 to 2 days. Fortunately, there are vaccines for flu viruses, which can help prevent catching it or reducing the symptoms of the more deadlier strains. However, there is no cure for the virus, so vaccines to prevent them currently is the best medical intervention. Mortality. The World Health Organization, WHO, has estimated that 1 billion people get the flu each year globally. The symptoms that are associated with influenza can lead to pneumonia. Compared to that, what we already know about the SARS-CoV-2, it appears that the mortality rates are for this disease is higher than that for the flu. How the influenza virus binds to respiratory cells. Viruses are microbes that invade other cells in the body, host cells, and can be used by multiplying within the cell host. In the case of the flu, the virus attaches to cells along the respiratory tract, like the nasal passages and the throat. The influenza virus, Humagottin HA, surface proteins attaches to the celiac acid receptors of the respiratory cell and binds to its surface. The influenza virus is then able to invade the cell and infect it. See image 4, photo influenza virus. How are vaccines made? Vaccines are first made by generating antigens. Preventative medicine reduces risk. Dead or weakened germs, antigens. Antigens are created as a response to the immune system seeking foreign invaders. Number 2, harvest the antigens. Once the antigens have been created within a cell, the next step is to remove it from the material in which it was created. However, unwanted material might still be present after harvesting the antigens. One type of purification process is called chromatography. 3. Purify. Depending on the medium used to create the vaccine, after harvesting the antigen, they must undergo a process of purification. 4. Enhancement. In this process, an adjunct is added which increases the body's ability to make an immune response. Next, chemical stabilizers are added to increase shelf life of the vaccine. Number 5, distribution. Bigger batches of the vaccine that have undergone the previous process are made, then broken down into individual vials, syringes, or freeze-dried. They are then distributed to healthcare providers. How are vaccines made? Cell-cultured versus egg-derived quadrivalent influenza vaccines. Currently, there are 2 ways in which vaccines are made. 1, egg-derived, or 2, cell-cultured. Flu virus mutates each year. The common strains are A and B, which need to be identified. Vaccines are created each year to fight the most common strains. Egg-derived vaccines are made by inoculating traces of the current strain of the flu virus into a grown chicken egg, and then allowed to proliferate within the egg. In cell-based vaccines, they are created by injecting cultured mammalian cells. Biko et al. Study on cell versus the egg-derived quadrivalent influenza vaccine concluded that cell-derived vaccines had a better vaccine effectiveness rate for the 2017-2018 influenza A H3N2 virus. However, viral effectiveness can be impacted by the clinical participant's history of previous vaccination, maturity of his or her immune system, and the amount of the flu virus present at the time of transmission. The FDA has approved for the 2019-20 influenza season the Influenza quadrivalent, which is the only cell-based inactivated influenza vaccine. The advantage of cell-based influenza vaccines are they are more readily available supply. Egg-based vaccines rely on ability of chicken eggs. However, cell-based vaccines like Influenza quadrivalent can be frozen and stored for some time. This is crucial in the event of an epidemic. Approved effectiveness of inoculation. The process of using eggs can create a situation where the vaccine is less effective in humans, as it is susceptible to egg adaptations. The results when influenza antigens begin to mutate during the egg-based process. Hope for a universal flu vaccine. There has been research development to create a universal vaccine. The hopes are that a universal vaccine would cover several strains of the virus that would be needed to recreate each year. As well, research hopes that a universal vaccine would prevent patients from needing a flu vaccine each year. The National Institute of Allergy and Infectious Disease is spearheading this development that will protect individuals from influenza H1 and H5 strains. The flu V is a form of a universal vaccine that the clinical trial phase of development under Dr. Maloney, an NIAID investigator. In this clinical trial, some adult participants were injected with flu V, and the rest of this group were given a placebo. However, all participants exposed to the various strains of flu. The results were promising, with few participants who received the universal vaccine developing flu symptoms or viral shedding. The results of the clinical trial were published in the March 2020 NPJ vaccine from the National Institute of Health. Hope for a universal. In conclusion, the influenza virus is one of the many respiratory viruses that present with similar symptoms. Knowing how to identify each one is important to effectively manage medical treatment. While there are no cures, the creation of a vaccine has been effective in its spread. Developing the appropriate vaccine requires much research each year to identify the most virulent strains each year. The flu usually will resolve itself within 2 weeks with over-the-counter remedies. Though the effectiveness rates can be inconsistent each year to year, everyone should be vaccinated. Those who are at risk of developing complications related to becoming infected, like the elderly or 65 years old, or individuals with chronic health problems. Not taking the flu seriously by avoiding the flu vaccine can prove to be deadly for those high-risk groups. Thank you for coming to this presentation, and please, if you can leave a comment below. In conclusion,